Firstly, what's your reaction to the change, and is it now time for a national campaign to boost confidence?
Well, I think we need more confidence in the AstraZeneca vaccine. Yes, it does have these very rare side effects of this unusual clotting, and about 1 in 1 million, 1 in 2 million people who receive that vaccine unfortunately die as a result. But that's different to actually basically saying you shouldn't give it at any age. So it's actually welcome that they give it it's available for people, at 40. But equally, the medical advice hasn't changed. You still, in fact, need it if mostly over the age of 60, because that's where most of the benefit is and less of a risk. So we need to make sure that the 60-year-olds, 70-year-olds get vaccinated because they've got much, much higher chance of dying if they get COVID compared to a 30-year-old, for instance.
The Prime Minister last night said that even if Australia does manage to reach herd immunity, we will still continue to have these intermittent lockdowns like what we are seeing at the moment. Does that diminish the incentive to get a vaccine, or is this expected given we're in a pandemic?
Well, I think over winter, we may have restrictions put in place to control spread, but I would think by the end of the year, once we have 70 to 80% of adults vaccinated, and that's quite achievable in my view, we should be able to give 1 million doses a week now because we've got adequate supplies of AstraZeneca because it's made in Melbourne. And there's 300,000 doses of Pfizer vaccine available a week now. That should increase to 2 or 3 times the amount in a couple of months' time when more is able to be imported from the US along with Moderna and another vaccine called Novavax. So we should be able to get to 2 million people being vaccinated per week, say, by early September. So, but once we have 70 to 80% of the population vaccinated, we know that hugely protects you, particularly if you're over the age of 70, from dying, even against these new Delta strains. In real-world data from the UK, if you've had 2 shots of either the Pfizer or the AstraZeneca vaccine, you've got a 90% protection or more from being hospitalised and probably 95% plus from dying. So once we get to that level, yes, we'll still get some spread, we'll get less, but the consequences are so much less. So I actually would think by the end of this year, lockdowns shouldn't be on the agenda unless something radically changes with yet another variant or something, because the current variants, the vaccines we've got, cover them.
I want to ask you about the situation currently in Greater Sydney. Based on the current numbers, how do you think that the city is tracking with the Delta outbreak?
Well, I think so far it's under control. I mean, if you look at the numbers per day, it's tracking along the same line as the Crossroads one did last winter, and in fact the Avalon cluster. So I don't think there's any evidence that it's out of control. I think it's still under control. What will happen over the next week? None of us know. But so far, we are seeing at least stabilisation of numbers. I think it'll fluctuate up and down. We might see 30 cases today, even 40 the day after, but, hopefully it's more around 20. But so far, there's no evidence that it's going exponentially out of control. So everything they did last week, limiting the number of people, really good contact tracing, because there's not many mystery cases, because they're the ones that you really worry about. In other words, the unlinked ones, because every one of those people you find, there's another person you haven't found. But so far, it's, doing what you expect with good contact tracing, good cooperation of the public, and a reasonable amount of restrictions. And even the lockdown, yes, you need that if you have lots of cases, and particularly mystery cases, but you don't see the effect of that for 5 days. The average incubation period is 5 days. So any effect we're seeing now is what was put in place last week, and the effect of a lockdown won't be evident for, till the end of this week or the weekend.
If we look at the approach that Western Australia and the Northern Territory are taking, they've pulled the trigger quite quickly and implementing a lockdown for parts of the state and the territory. How does that compare with Greater Sydney, and was that a better approach to call a quick circuit breaker lockdown initially?
Well, my view is the New South Wales approach has been, I think, more reasonable. It's saying, look, up to a certain stage, we can handle this, but once numbers get to a certain level, or if we get a lot of mystery cases, that's where we have to have much, much more severe restrictions. I'm still not convinced that any of these short lockdowns they've done in New Zealand, Western Australia, across every state in Australia other than New South Wales almost, has made any difference. Because as far as I can see, they haven't found any more cases that hadn't been found already by good case finding and contact tracing. and the general public cooperating, things like wearing masks indoors, limiting movements, etc. So there's a lot of social and economic harm by lockdowns. And if you're really going to do a lockdown, given the average incubation period is 5 days, you probably have to do it for at least 7 days and more likely 14 days if you really think there's cases out in the community you haven't found. So while the short lockdowns give the contact tracers a bit more time, if you've got enough contact tracers and you can handle it, I would have thought the approach where you just basically lock down the contacts or the close contacts, etc., and only pull the other trigger if you really look like, there's cases in the community that you're not finding in a timely fashion and are moving around too much.
Professor Peter Collignon, we have to leave it there. Thank you for joining me this morning.
Thank you.